Hello, my name is Susan Aikenhead and I am Director of Nursing Professional Development at NHS England. Leading Change, Adding Value is the national framework for nursing, midwifery and care staff. The framework demonstrates the contribution as professions that we can make to the 5-year forward view and other national policy by addressing unwarranted variation in practice. By doing this, we can demonstrate how we can close the 3 gaps in the 5-year forward view and demonstrate our outcomes of better outcomes, better experience and better use of resources. To do this, research is an integral part of this work and research runs concurrently throughout the framework. We also have a specific commitment number 7, that addresses research and its importance to practice. We were delighted today to co-facilitate a meeting with HEI colleagues hosted by Professor Jane Cummings as Chief Nursing Officer for England and Katerina Kolvia as Executive Director for the Council of Deans. We've had a very productive morning with HEI colleagues discussing the visibility of nursing, midwifery, care staff research across all the sectors and the importance of different roles and various other aspects of this work.
I'm Katerina Kolvia, the Executive Director at the Council of Deans of Health.
I'm Patrick Callahan, the Research Executive Lead for the Council of Deans of Health.
And we're going to talk about the impact and visibility of nursing and midwifery research in England and our commitment to increasing visibility. And as a Council of Deans of Health, we are committed to influencing and working in partnership with policymakers in England to ensure that nursing and midwifery has the right positioning in terms of its research capacity and capability, and that by doing that we increase capacity in our disciplines across the country and across all sorts of specialisms.
And one of the many areas of research that the Council of Deans is leading on, one I would like to particularly drive is fostering the role of the clinical academic careers in nursing and midwifery. I see it as a fantastic future to really transform the impact of research in those disciplines.
I'm Karen Spilsbury, a Professor of Nursing at the University of Leeds. We are committed at Leeds to delivering research in partnership with policymakers, providers, commissioners and the public to ensure that nursing research answers questions that matter to the patients that we care for, whether that be patients in acute care, in the community and also in care homes. So we think broadly around health and social care research and how to really make a difference and demonstrate the value of nursing.
My name is Julie Jermaine. I'm Dean of the Faculty of Health Sciences and Professor of Midwifery at the University of Hull. My commitment really in terms of research and building nursing and midwifery research is to continue to try and develop and attract the best research leaders to our institution. But actually it's about the whole clinical career pathway. So it's about how we embed research more effectively into our undergraduate curriculum, how we talent spot from that point, but also across nurses and midwives' career pathways in order to bring them into the organisation, to support them in terms of research, development and growth, and grow those future leaders from inside.
I think I'd also say that I think one of the key things is that we think about the 5-year forward view and the sort of agenda around integrated care and just the increasing sort of complexity of people's needs. So a lot of older people with many comorbidities, etc., and thinking about research that really addresses sort of care needs for those groups.
I'm Hilary Garrett. I'm Director of Nursing for NHS England and Deputy Chief Nursing Officer for England. It's natural to want to find out new things, and how do we find out new things? We do that through research. We find new evidence, or we apply evidence to see how that works in practice. And I think second to that, we need to also have organisations that want to not just to find new things, but to improve on those things. So how do we do that? And that's where unwarranted variation comes in. So what's happening in my practice compared to another area, what's happening in practice in another area, and that can be either a ward or a nursing home or in a bigger environment and a whole geography, for example. And then once we've done that and we've improved, the big question is, so, okay, how do we maintain what we've done? How do we maintain the gold standards of practice? And again, using research to constantly test that we're on top of our game and constantly improving.
Ian Peat, I'm the Professor of Nursing at Gibraltar School of Health Studies, and I'm the Editor-in-Chief of the British Journal of Nursing. And I'll be supporting Commitment 7 of leading change and adding value in many ways, through the publication of all of the debates today that we've had in the British Journal of Nursing, by highlighting and ensuring that what we've got in place works and is fit for practice. I'm also very keen to hear from any nurses who have got any case studies that they want to share with us, and we look forward to publishing them in the British Journal of Nursing in order to highlight and to stress the importance of this initiative.